If you've had a transplant, you learn the meaning of life.
Within the historic Royal Free Hospital in London lies a dedicated team of professionals committed to improving the lives of people with liver disease. The team is now at the forefront of diagnosis and treatment around the world. Physiotherapist Lynne Burton had suffered from ill health much of her life, but it wasn't until age 20 that the real cause came to light.
I was first diagnosed with liver failure in 1995. I was diagnosed with primary sclerosing cholangitis. With hindsight, I can see signs of my liver disease right from early childhood. In sixth form, it was very noticeable. I was asleep by 8 o'clock every night. During university, all the time I was really ill and unable to do anything. And that was my life, which wasn't a life. In 1999, I had a major GI bleed at the hospital I was working at, and the registrar there got me transferred to the Royal Free. And after being at the Royal Free, well, just one day, they realised that I was going to need a transplant fairly soon.
As soon as a patient is on the transplant list, they will then see a transplant coordinator. This is just the beginning of the care they and their families will receive from a dedicated team of as many as 20 professionals.
Our role is mainly to support the patients and their families through the whole process of transplantation. We see the patients initially when they're referred to us for assessment for transplantation and organise their tests and talk to them about what the tests involved and what will happen once we get the results back. We then organise the actual transplant operation itself when we have a liver offer, and also again give a lot of information and support to the families and the patients at that time.
The transplant procedure itself usually takes about 5 hours, sometimes a little less if it's a relatively straightforward procedure, and sometimes considerably longer if it's more complicated.
As transplant coordinators, we would always go into theatre with the patient because it's quite a frightening and anxious time for the patient and for the families. And then for the rest of the transplant, we would keep in touch with the families to let them know how things are going and when they're expected out of theatre.
The staff acknowledge the fact that your family are very important to you and that they need the support as well.
We needed them both for the actual mechanics of having a transplant, the emotional support, the medical support.
Post-transplant, when you're at home alone for the first time, it's very scary because it's what if something goes wrong. But you also do know that you've got the answer on the end of a phone.
After a liver transplant operation, one of the very pleasing things and satisfying things, most for the patient obviously, is that they can feel better very, very soon afterwards.
The first thing I really noticed post-transplant was energy. I had energy and I hadn't had energy for years. You could see the start of life again. I got out of hospital on Millennium UZ. Wonderful, it seemed like an omen, new life, new start, new millennium, and everything looked perfect. But unfortunately, 3 days later, I was in a car crash and I ended up with a spinal cord injury, which put me into a wheelchair. But if I was going to become disabled, it was a good time to have them because I had energy post my transplant. I'd been given a transplant to have a life, and not being able to walk very well wasn't going to stop me having a life. Pre-transplant, I'd heard about the transplant games, and I said right from the beginning, I'm going to take part in that. So I took up archery because you can do archery just as well from a wheelchair. So I went to my first transplant games in Leeds in 2001, and I won gold in the archery, which was my first ever archery medal. I then took part in the Disability Sport England Nationals, and then at the beginning of 2007 I suddenly found that I was on the Great Britain Paralympic Archery squad, and at the moment it looks good to go to Beijing to shoot for my country.
I think the strength of this unit is really very much the enthusiasm of the people who work within it and wish to expand it in the future.
You're so looked after by everyone, and it is a team effort. It is the nurses, it is the doctors, It is the transplant coordinators. It is the massage therapist. And it is as well the chaplaincy. Once you're being transplanted, you are part of a family at the Royal Free.